ang tanong is, yung tatlo ba na yan, yung 3 stages na yan, MK1, 2, and 3, have that DMS? Answer is yes. Lahat sila merong DMS. The problem with megakaryoblast, take note, is that DMS is not visible yet in megakaryoblast. Meron kang DMS, but it's not clearly visible because at this stage you have a very large nucleus pa, and that nucleus almost cover up the entire cell. Okay, so hindi mo pa makikita agad-agad yung DMS. But if the question is do your megakaryoblast contain DMS? Answer is 100% yes. Meron siyang DMS although it's not visible. Okay? You will only start to observe for this DMS when you reach your promegakaryocyte. So that's the first stage that will clearly show you your demarcating membrane system. Okay? And this will be the last stage that will allow you to have your endomitosis. Kasi when you reach your megakaryocyte, that is when you will now start to create or release out your platelets. O dyan na siya. Ganyan na siya ilalabas. And megakaryocytes could either be mature or immature megakaryocyte. O pag sinabi nating mature, it can release out the platelets. But if it's immature, it will not release out the platelets yet. Kasi as for some literature, for your cell to release out the platelets, for some literature, yan, especially mga medyo luma na book, at least 4 na nucleus yung kailangan mo for you to release out your platelets, to shed out your platelets. And that platelet shedding is what we call as, so let's say you have your megakaryocyte here, it's already mature. That platelet shedding is what we call as thrombocytopoiesis. Okay? Thrombocytopoiesis, meaning to say, you are now shedding out your platelets. Thrombocytopoiesis. And from your megakaryocyte, you can release about 2,000 to 4,000 platelets. Sa isang megakaryocyte yun, ha? You can then shed out or release out about 2,000 to 4,000 platelets. And as to theories, once platelets are released out from that megakaryocyte, it goes through your endothelial cells. Endothelial cells within your blood vessels. It punches through your endothelial cells para yung platelet natin mapunta ngayon sa blood. Okay? The thing is, not all platelets that you produce will be present in your blood. Only about 70% of platelets will be in your blood and the other 30% will be sequestered in your spleen. Doon siya mapupunta. Para saan? As to studies, it's for future use. Let's say you had a severe injury, so possibly there's a possibility that your spleen may then shed out or release out your platelets. Kasi remember, yan, hopefully you have attended the orientation. We cannot afford to have too much of your platelets in your blood kasi it poses risk for thrombosis. Right? Baka mag-form nga ng mga unwanted clots na yan. Tama? So, what we do here is only about 70%. O for example, do the math na lang. 2,000 for example yung platelets nyo. Ilan yung 70%? 1/4 for example. 1/4 lang yung mapupunta sa blood. Yung 600 mapupunta sa spleen. Okay? And once your megakaryocyte here has released all the platelets inside, it makes or it leaves your megakaryocytes called as naked. O parang nakahubad na yung megakaryocyte natin. And once your megakaryocyte is said to be naked, it will then be cleared out by your phagocytes. Yung mga macrophage natin. sa bone marrow natin will then clear out your megakaryocyte. And by the way, there are studies suggesting na a little portion of megakaryocytes could be present in your lungs. Roughly about 1% could be present in your lungs. Okay? So, listed here, on this next slide here, hindi ko na isa-isahin are the characteristic features of your MK1, 2, and 3. Yan, especially with regards to the size. So, tingnan nyo yung size. As the cell mature, MK1, MK2, and then MK3, palaki siya ng palaki. And in some literature, it can even go as high as 180 to 100 micrometer in diameter. Okay? And when you reach this stage with this megakaryocyte, it will then show you different receptors or different markers. And with the advent of technology today that we have, we can now test for these markers. We can now test for this receptors. Okay? Kasi there are times that these markers or these receptors are tested so we can then diagnose diseases. Okay? Yan, kunyari, meron kayong tests like flow cytometry, yung mga cytochemistry, yung mga molecular studies, yung mga in situ hybridization, something like that. You can now test for these markers so that it can help you diagnose certain hematologic diseases. Okay? So for example, when you have your megakaryocyte, you will have a marker called MPL. Okay? And that MPL serves as the receptor site for TPO or thrombopoietin. Kasi pag dumikit si thrombopoietin on our megakaryocyte, it will further enhance the release of your platelets. Okay? Actually, si MK1, 2, at 3, meron niyang MPL na yan. Kailangan meron kang receptor site for thrombopoietin so that your cell will mature, will undergo endomitosis, and allow you to release your platelets. Okay? So yan, again, MPL serves as your receptor site for TPO or thrombopoietin. And MPL MPL stands for myeloproliferative leukemia. Yan, as to studies, if I'm not mistaken, it's a viral oncogene associated with myeloproliferative leukemia. Kaya tinawag na MPL. Okay? Then you also have here CD34, which is needed especially for your progenitors so they can then mature well. But then later on, yung CD34 na yan nawawala. Okay? It disappears as your cell continuously differentiate and mature. But for progenitors, usually, meron ka lagi niyang CD34 na yan. Okay? Then you also have here glycoprotein 2B3A, which first appears on your megakaryocyte progenitor. Yan sa mga, pag sinabi natin progenitor, I'm referring to to BFU at saka CFU, okay? It first appears on your progenitors and it will then remain present all throughout the maturation. But aside from GP2B3A, you also have other markers like CDs, yung mga CD42, CD61, CD62, yan. Present din sila, which serves as markers also for your progenitors. So if you look at this figure here, what's important to remember with these markers is that you know which stage possesses that marker. Kasi if you want to test for that marker, and normally, wala naman pala yung marker na yun dun sa stage na yun, kahit anong tumbling mo, magne-negative yan. Tama? So you need to make sure na you know that this stage, sir, contains this marker. For example, sa CD34, as what we have said, pag nag-mature, nawawala. O let's say, you keep on testing CD34, pero ang specimen mo pala is megakaryocyte. O kahit anong tumbling mo dyan, sa megakaryocyte na yan, wala kang makikitang CD34. But if you will go with these progenitors and you test for CD34 and it's positive, then that's normal. Kasi yung mga progenitor na yan talagang merong CD34, right? But let's say, sir, I have this progenitor pero walang lumabas na CD34. O that's the time you consider it as abnormal. Did you get that? Nakuha ba yun? Sige nga, tingnan natin kung gising. Let me see a thumbs up. If we are still up. Excuse lang, ha? Excuse lang for a while, ha? Okay, so moving on. O, ito na yung binanggit natin kanina, ha? Yung platelet shedding or anong tawag natin sa platelet shedding? How do we call it? When your megakaryocyte starts to release your platelet. Thrombocytopoiesis. Okay, so that is when your megakaryocyte, excuse me, starts to release out or shed out your platelets. That's the actual term actually. Yung shedding out o parang nilalabas ni megakaryocytes yung platelet natin. Okay? Then again, as mentioned, once your megakaryocytes have released all these platelets inside, it will leave your megakaryocytes naked that will then later on be removed or consumed by your phagocytes or yung mga macrophages natin within our bone marrow. Okay? And then lastly, before we go to platelets, so the following here are the different hormones or cytokines that controls your megakaryopoiesis. Okay? Remember, in hematopoiesis, you will produce what your body needs. Okay? Hindi sobra, hindi rin kulang. Kung ano yung kailangan natin, that is what you need to produce. Okay? So, in essence, I need to produce cells, sir. Okay? I need them. I need my platelets, I need my red cells, I need my white cells. That's why we have stimulants, right? O for example, siguro si thrombopoietin natin, right? But at the same time, you also need to control them. So that's why there are also certain inhibitors that will initiate the stoppage of this cell production. Or these inhibitors will then lessen the production of that particular cell. So check and balance lang, remember. Your body will produce what you need. Not too much, nor too less. Just enough. Just the number that you need, the number that your body needs to be functional. Okay? So the stimulants that we have here will be the following. So meaning, pag sinabi nating stimulant, they enhance megakaryopoiesis. They help you create out your platelets. So primarily, syempre number one dyan, si thrombopoietin, which is derived from your liver or your kidneys and sometimes even on your smooth muscle cells, dyan mo makukuha si thrombopoietin. Just remember that thrombopoietin is the primary control mechanism that we have for our platelet count. It controls your platelet count basically. Okay? Kung kailangan mo ba ng mas mataas na platelet count or mas mababa, it depends on your thrombopoietin. And at times, if a patient has thrombocytopenia o mababa yung platelet count ng pasyente, let's say, you can give thrombopoietin synthetics. O meron tayo nun sa market, ha? Meron tayong mga parang analog ng mga thrombopoietin. So it's given among those patients who experience thrombocytopenia. So binibigay yon hoping that it will increase their platelet count. Okay? Then you also have interleukins, yan, especially si interleukin 3. Yan, common naman yan generally in hematopoiesis, whether it's red cell, white cell, or platelets. So interleukin 3, which acts in synergy with thrombopoietin for the differentiation of your cells. You also have interleukin 6 and interleukin 11, which acts in the presence of TPO. Imagine niyo, kung wala si TPO, wala ring silbi ang mga interleukins na yan. Kaya we said na TPO is the primary control mechanism for your platelet count. Okay? So again, interleukin 6 and 11 acts in the presence of thrombopoietin, so you can further enhance endomitosis and the maturation of your cell. Yan, even platelet shedding. So para ma-release mo sila. Okay? And then lastly, these inhibitors here, yung mga nakasulat dyan, they were tested in vitro. Pag sinabi nating in vitro, outside your body. Right? So they are proven to inhibit megakaryocyte growth. So scientists believe that in vivo, they also function the same. Okay? Proven sila in vitro. Okay? So the scientists believe that they will also have a role in the control of megakaryopoiesis in vivo. So most likely, if they inhibit megakaryocyte production in vitro, they will also inhibit it in vivo. Okay? So before we go to platelets, do you have any questions or clarifications? May tanong po ba or clarifications? Everything clear so far? Okay. Sige, so moving on. So after megakaryopoiesis, after your megakaryocytes have released your platelets, the next thing we do is, let's now study your platelets. We know that platelets are the smallest cells in our blood, right? They are only about 2 to 4 micrometers in diameter. Ganun lang sila kaliit. Yan, ito nasa picture na yan. Ganyan lang kaliit yung platelet natin. And roughly, your platelets having that size will then be about 8 to 10 femtoliters in volume. Yan, kung babalikan nyo sa HEMA 1 nyo sa mga automated machines, for your CBC machines to count a cell as a platelet, roughly it should be about 2 to 20 femtoliters, right? But in the actual measurement as to the volume of your platelets, generally, it's 8 to 10 femtoliters. So sa mga machines natin, if it's anywhere in between 2 to 20 femtoliters, it will then be counted as a platelet. And as what you see here on this figure, wala namang nucleus yung platelet natin. Okay? They don't have the nucleus, but they have mitochondria inside. Mitochondria that will help you produce energy. Unlike RBCs, yung mga mature RBCs natin, wala silang mitochondria sa loob. Kaya they source their energy from sugar. But with platelets, they have mitochondria which allows them to have that energy they need. Okay? And then they will circulate in our blood for about 7 to 10 days. In some literature, up to 11 days. So generally, it's about 7 to 10 days. And normally, it's anywhere in between 150 to 400 times 10 to the 9 per liter. Lower, definitely, as compared to your RBC count. Okay? But with this value here, with this normal value here, expect that as we grow old, this value will then decrease. Yan, especially pag umabot na tayo ng senior citizen age natin. 65 pataas, ayan. Normally, bababa na yan. 120 to 350 normally for men, and roughly 140 to 300 plus something for women. pababa siya ng pababa. Okay? Because the rest will then be sequestered in the spleen of that grown individual. Okay? And uh, if you will have a further closer examination on your platelets, later on, platelets will then give you different layers. But sometimes, your platelets will appear something like this. Look at this, ha? Ito. Yan yung platelet. Sir, bakit ang laki ng platelet natin? Bakit, sir, mas malaki yung platelet natin? Sometimes, it appears something like that, especially when your platelets are said to be stressed, reticulated, or stressed platelets. It's actually a response from our bone marrow, especially if your body has thrombocytopenia. O let's put it simply. Gawin natin simple lang. Mababa yung platelet count mo ngayon, for example. Okay? So kung mababa yung platelet count mo, your bone marrow will respond. Okay? It will compensate. Ang ginagawa ng bone marrow is pinapabilis yung paglabas ng platelets natin. And because of that, your platelets will not be fully mature enough. So that's why they may then appear to be larger. Okay? So it carries free ribosomes and fragments of your endoplasmic reticulum, which then allows your platelets to be larger than the usual size. Okay? Kaya yung volume niyan kanina, di ba, ang normal volume natin, roughly mga 8 to 10 femtoliters lang, right? Pero dito, it can then go as high as 12 to 14 femtoliters in volume. Pag mas malaki, and it's responding to thrombocytopenia, or you call it as reticulated or stress platelets. But mind you, yan, pagdating natin ng finals, there are certain diseases which then causes your platelets to become giant. O may mga ganon. Okay, but if it's responding to thrombocytopenia lang, you call this large platelets as stressed or reticulated platelets. Okay? And then lastly for today, if you will further examine your platelets, again, it will give you various or different layers. So the first thing that we have here is what we call as the peripheral zone. The peripheral zone, which is considered as the transmitter or the stimulus area of your platelets. Pag sinabi nating peripheral, o kunyari, ito yung platelet natin, nasaan dyan yung peripheral zone? Peripheral. Sinabi nating peripheral, periphery. Nasaan dyan yung platelets? Nasaan dyan yung peripheral zone natin? This is your platelet here. Uy. Yung nasa gilid. Tama? It's the membrane itself. Tama? It's the platelet membrane itself. That's why you call this peripheral zone as the transmitter or stimulus zone of your platelets. Nasa gilid, meaning to say, anything that needs to bind with your platelets, anything that needs to enter or leave your platelets, saan sila dadaan? It's on your peripheral zone. Tama? Lahat ng papasok, lalabas, didikit, tatabi kay platelets, it will all be on your peripheral zone. So in that peripheral zone, you have your plasma membrane. Yan. Especially, that plasma membrane is made up of phospholipids, which forms the basic structure of your platelets. It has lipids. Okay? And because of that lipid, this plasma membrane here becomes selectively permeable. No, pag sinabi natin permeable, sir, may nakakapasok, may nakakalabas. Pero in this case, take note, it is selectively permeable. Not everything can enter or leave your platelets. Okay? And that phospholipid is bilayer. Okay? Which provides support for your platelet activation. Kasi remember this, as platelets circulate in your body right now, platelets technically are inactive. Pag inactive yung platelets natin, you will not form clot. Okay? So, when do we activate platelets? What do you think? When should we activate your platelets then? Kapag nagbi-bleed ka, right? Kapag meron kang injury. Tama? Pero kung wala, as the platelets circulate right now in your body, they are inactive. So through this phospholipid layer, through this bilayer, later on, it will support platelet activation. Okay? Kasi on that phospholipid, marami tayong klase ng phospholipid by the way. Right? You have phospholipids like phosphatidylinositol, yan, which supports platelet activation, yan, para magkaroon ka ng thromboxane A2, ayan, pag-usapan natin yan next week. Yan, phosphatidylinositol. You will also have their phosphatidylserine, which will then be used by your clotting factors. Point is, I need that phospholipid to form the structure of my platelets to be permeable, but most importantly, that phospholipid will help my platelets or will support my platelet activation. Kasi in cases of injury, I need to activate my platelets so I can form a clot. Okay? And this cholesterol here, later on, it will then stabilize your membrane and then allow your platelets to remain fluid. Meaning to say, it allows your platelets to remain permeable, selectively permeable, para may makakapasok at saka merong makakalabas. Okay? And the next one here is your glycocalyx. Glycocalyx, which technically allows your platelets to absorb substances. You listen carefully, ha? You listen. This is my platelet, for example. It circulates in the blood right now. Okay? Then, let's say there is a clotting factor here. So let's say there's calcium here. Clotting factors will help you form a clot. Calcium is an example of a clotting factor. So calcium will help you form a clot. Okay? You listen carefully, ha? So what your platelets will do is, if there is no injury right now, platelets will circulate and will absorb substances that can help you form a clot. Platelets will absorb them so that you can then store them inside the platelet. Para sa answer, so that when the need arises, meaning the moment you have an injury, what your platelets will do is release those granules and let them form a clot. O kunyari, itong si calcium, inabsorb ng platelet yung calcium. Tapos, nakakita si platelet ng injury. Gagawin ng platelet is, it will release that calcium and let your calcium do its job. Kasi one of the job of our calcium is form a clot. Kaya matututunan niyo yan sa mga susunod nating meeting. Did you get the point? That your platelets have the ability to absorb substances that can help you form a clot. Nakuha ba yon? But just to be clear, platelets are not the ones to create clotting factors or this calcium, let's say. Ano lang ang ginawa ng platelet natin? Platelets just absorb them. But platelets were not the ones to create them. Am I clear on that matter?
Yes po.
Yes po, sir.
Okay, maliwanag yun, ha? Hindi si platelet ang gumagawa, ha? So parang ginagawa lang ni platelet is iniipon niya. So parang taga-ipon natin yung platelets natin. Okay? And through this glycocalyx, because of its content, this also serves as the site for your platelets' antigenic activities. Because of that glycocalyx, glycoprotein, di ba? Parang RBC natin. Yung RBC natin has antigenic sites. right? Kaya ka blood type A kasi meron kang A antigen on your red cell, tama? So in this case, your platelets also do possess that through its glycocalyx. That's why your platelets can then participate in your body's immunologic activities. That's why platelets play in your HLA, in your major histocompatibility complex. Yan, kung i-connect nyo sa immunosero ninyo. Di ba? Sa MHC class 1 natin, you have there your platelets, right? So it's because primarily of your glycocalyx, okay? Then you have here your open canalicular system or surface connected canalicular system. So parang kanal. Pag sinabi natin kanal, daanan, right? So it primarily controls the extracellular and intracellular activity of your platelets. So anything that will enter or leave your platelets will then pass on through your open canalicular system. Okay? And through the submembranous region, it interacts with contractile protein so that later on, your platelets can attach on your damaged blood vessel. Okay? So pag nakakita na si platelet noong injury, so for them to be able to bind on that injury, so it's through your submembranous region under your peripheral zone. Sa tandaan, yung peripheral zone na yan, that is the transmitter or the stimulus zone of your platelets. Okay? And then, next one here is your cytoskeletal structure. Pag sinabi nating cytoskeletal, it facilitates the shape of your platelets, right? So pag Soldier zone, you have there primarily two important components, your microtubules and your microfilaments. Okay? Microtubules primarily helps your platelets to remain inactive. And remember, if platelets are inactive, they are discoid in shape. Okay, marami tayong microtubules ha. Iba't ibang klase ng microtubules meron tayo. Okay? So, if your platelets need to remain inactive, primarily, kailangan mo yung mga microtubule na yan. Okay? But, when your platelets need to change their shape, you will need microfilaments. From discoid, it can be irregular in shape. If platelets are discoid, ulitin ko, they are inactive. But if platelets change their shape, it means that platelets are active. O, ulitin natin, kailan natin ina-activate uli yung platelets?
If there's injury or bleeding.
If there's an injury. Tama? Follow-up question, sir. Why do platelets need to change their shape? So that your granules inside, the substances I have collected a while ago, will be released. If platelets will not change their shape, those substances will not come out. Okay? So for your platelets to release those substances, they need to change their shape. And they will need this protein, thrombostenine, so that platelets can contract. Well, look at your hand right now. Gawin nyo, close, open nyo yung hand nyo. Oh, that is contracting. Kasi it's not enough that your platelets will change their shape. They need to contract. Ayan, isipin nyo yung kamay nyo, close, open. So that more granules will then come out. Okay? So through the soldier zone, it will primarily facilitate the shape of your platelets. Again, they are discoid if they're inactive, and they are irregular in shape if they become activated. Okay? And then lastly, the metabolic zone of your platelets will then be your organelle zone. Kasi nandyan si mitochondria natin, that gives your platelets their energy. And then more so, you have here your so-called DTS, or dense tubular system. DTS, remember, is the control center for platelet activation. Okay? Kasi on this DTS, you have here enzymes that will then be needed for the activation of your platelets. And more so, in dense tubular system, this is where you store out your calcium. Yung mga kinolekta ko kaninang calcium, it will be stored on your dense tubular system. So once I need them, once there's an injury, I will just release them. And to make sure that I can fully activate my platelets, I will need enzymes that could be present on my dense tubular system. Okay? And then lastly, other substances that are collected by your platelets will then be on your granules. Alpha, dense, or lysosomal granules. Lysosomal, yan, yung mga enzymes that could then be probably used to digest certain components present within your platelets. But when it comes to clotting mechanism, the two most important will be your alpha and your dense granules. Okay, you have different alpha granules that works hand in hand with your open canalicular system para makalabas sila, yan pag meron kang injury. And four important granules that are unique among your platelets will be your platelet-derived growth factor, beta thromboglobulin, platelet factor 4, and thrombospondin. Yang apat na yan are part of your alpha granules. Okay? Pero, they are not limited to these four ha. Sa alpha granules, marami pa yan. But these four here are unique among platelets, meaning only platelets have them. Especially these two. Platelet-derived growth factor and beta thromboglobulin are needed for vascular integrity. It allows your injured vessels to be healed, to be repaired. Kaya yung platelets natin are also part of your healing process. It's because they have granules such as this that will help your vessels, those endothelial cells in your vessels, to be healed or to be repaired in cases of an injury. Okay? Pero again, hindi lang apat ang meron sa alpha ha. Marami pa yan. Okay? Then for the dense granules, to name a few, examples ng mga dense granules natin will be calcium, ADP for platelet aggregation. So for your assignment, yan, i-jump ko lang ha, nilagay ko rito, reading assignment ninyo, basahin nyo ano-ano pa yung mga alpha at saka yung mga dense granules. Hanapin nyo kay Rodax. Meron yan kay Rodax. Okay? Para matuto kayo magbasa ng libro. So, these granules, again, will be released once your platelets are active so that it can facilitate then the formation of a clot. Because without these granules, your platelets will be non-functional. So, kailangan mo yung granules na yan so that you can allow your platelets to later on do their job in producing or in forming rather a clot. Okay? So this is technically the structure of your platelet. So meron kang phospholipid, meron kang cholesterol that supports the structure of your platelets, and at the same time, you have your microtubules and microfilaments that will then facilitate the shape of your platelets. And then along the way, you have different proteins and you have different